Welcome to Physiopanda, guys. Today I'll be discussing something very crucial for my physiotherapist friends. These are some suggestions come advisory for physiotherapy OPDs and as well as people going for home visits. Myself, Dr. Fusion, physiotherapist. Today we'll be discussing about these suggestions. So I've divided these suggestions into three phases basically. So the first phase, I call it as an informative phase. So what is this informative phase? Call and message all your patients regarding all the steps your clinic, your hospital, your setups are taking regarding COVID-19. The second step is all treatment must be scheduled with specific timing and strictly on appointment basis so that there is less of crowding in the clinic or the hospital department. Next, instruct people not to bring any caregiver. If possible, don't ask them not to bring any caregiver because we want social distancing with this. Next, inform them that if they are suffering from cold, cough, fever, kindly cancel their appointments. Then second phase is called as a preparatory phase. That is, the first step is clinical hygiene. Frequently sanitize everything after each treatment. Sanitize frequently touch surfaces by patients like doorknobs, paddle bars, washrooms, your couches, equipments, exercise equipments like dumbbells, and etc. Sanitize your floor, door, table, bed, machines, benches, etc. Sanitize before starting and ending the clinical hours. Very important point. Keep distance between the couches as much as possible, like 1 meter if possible, because I know that there is not a lot of space in the private clinics. So try to maintain. If you can't maintain that gap, use curtains. Curtains will be the best to avoid these, like if somebody is sneezing, like it is good to have curtains. And please make sure that you wash your curtains daily after the OPD. It's very important to maintain the hygiene nowadays. Next is take advisory charts along the clinic so that people know what they are doing, right? So the next step in phase 2 is the personal protective gear for physiotherapists. So you should have an ample supply depending on your patients, how many patients you're getting, how many staff you have, how many supportive staff you have. So what equipments you need or the protective stuff you need, you should have everything basically disposable, like disposable gloves, disposable mask. You can use N95, you can use your surgical 3-ply mask, use disposable sheets on your couches. Then you have disposable gowns and aprons. If you can afford that, please use disposable gown and apron with full sleeves. If not, then use your normal apron with full sleeves and make sure to wash them daily on the daily basis. So it's better to have 2 or 3 pairs of what do you say on the aprons. Then please have a good supply of hand sanitizer, preferably with more than 60% of alcohol content. Use tissue roll instead of using towels, instead of using small napkins. Use tissue rolls so that you can just wipe anything off your instruments and just throw it out in the dustbin and dispose it off. Heavy duty cleaning gloves are very important for general sanitization, like you need to scrub the floor and that is for the support staff for sure. General cleaning supplies, preferably with 1% sodium hypochlorite or something with bleach, will be very great to sanitize the floor and everything. Have well ventilated spaces. Have disposable shoe covers for the patient as well as for the staff and the supportive staff or the hospital staff coming to your department. Disposable eye gear if you can afford it, if you're working especially in hospital. If you can't, just have your big glasses on, maybe the specs will also work. And you know how to maintain general hygiene. Don't need not to touch your nose, ears and eyes. Then I have the third phase called as the treatment phase. So first point will be strict appointment based system. Second is have a registration assessment form with specific details mandatory, like contact information, that is the phone number of the person, the landline number, the address, complete address of the person, history of past travel, the temperature of the patient, and the observation, your observation, like the person is having cold, cough. In the first informative phase, we have told the patients that please tell us if you have this, don't come to the clinic. But still, if you see any patients doing this, please cancel their appointment. It's very important. Keep a sanitizer and preferably soap and water outside your department so that patient wash their hands, sanitize and then enter. Ask them to put the shoe covers on, then come inside. If possible, give or ask your patient to get mask, because nowadays masks are very expensive. So I'm quoting both the statements. You can ask the patient to get the mask, you can provide a mask to the patient, whatever suits you, but it should be one of the key element in this. Make sure patient sanitize before entering. Use shoe covers. Already discussed. Temperature check. Check it yourself with a IR thermometer, that is non-contact thermometer. It's very important, and full it. Form should be completely filled. I told you, assessment form. Check for any red flags and yellow flags. You think that patient can have a communicable disease, please don't enter in these kind of patients. Immunosuppress this compromised patient, please have a good history and write everything down. No waiting policy, strict no waiting policy. Give appointments, patients coming on the time, entertain the patient. We don't want overcrowding, we want social distancing as much as possible, because as physiotherapists we have to touch the patient a lot. That means we are more closer to the patient, so we need to avoid that. Restrict to patient only guidelines where applicable, means try not to have caregivers in the clinic. If they still come to the clinic, ask them to wait outside the department, not inside the department. Right now, phase 3, next thing is for the therapist. Prepare yourself with protective gear as per needed. Wear mask, change your mask 5 to 6 hours, and dispose them with proper guideline. In the last video I have told the guidelines how to dispose a mask. For every patient, wear one pair of glove. After you have seen the patient, just discard and use another pair of glove for another patient. This is very important point. Wash hands and sanitize your hands after every patient dealt with. Next, change bed sheets. Have disposable bed sheets. Change them after every treatment protocol. Like one patient came to me, he's lying on the bed. Once he goes out, just change the bed sheet, dispose it off, and put another disposable bed sheet. This will be one of the best thing you can do to avoid the spread of communicable disease of COVID-19, because patient will be lying on the bed. So we don't want the patient to touch the bed. It is best to have disposable bed sheet. Clean all the equipment in use like electrode pads, US heads, cupping sets, exercise equipments, and whatever the patient may be touching. It's a very important point. Next, the last phase will be the prevention. These are the some general advices, like if possible suspend OPDs if you can for a week or so, with the as per the advisory of different ministries and state ministries and the government of India health ministries. General precaution must be carried on, like personal hygiene and everything. If suspect anyone that they are having some symptoms, please inform the local authorities as per the advisory by Ministry of Health and Family Welfare, Government of India for private setups. Maintain good hygiene practice for self and support staff. It is very important that whosoever is in your clinic, whosoever, maybe the maid, maybe your the support staff, maybe all your colleagues, your head of department, everybody has to follow the same protocol. Very important. Then do not exchange writing equipment. This is very common thing what we have, that we are writing something, somebody asks for a pen, we just give the pen to them. Have your own pen, have your own writing pad, maintain that distance. This is very important to prevent communicable diseases. Avoid touching random surfaces if can be avoided. Don't try to just stand over there with touching the table. If you can avoid touching the surfaces, as many surfaces can possible, good to go. If possible, work on rotational basis. Suppose we have 6 staffs in the clinic or the department, try to come on 3-on-3 basis, 2-on-2 basis, and schedule your patients accordingly. It's very important to have that, because we don't want overcrowding. Then kindly use personalized vehicles. Don't use public transport nowadays. If required, use your personal vehicles whenever required. Kindly advise more of home protocols. Tell them more of home exercise, right? If not needed, avoid patient entering the clinic. Try to maintain basic queries on phone, right? If patient says, okay, I'm having this, I can't come to the clinic, or should I come to the clinic? If you think there is no need to come to the clinic, just advise everything at home. Again, very necessary to have social distancing from the patients. Then spread awareness, very important. Again, because I've seen that on WhatsApp everybody is sharing something or the other thing. Please don't fall into that. Spread awareness. We are the learned beings. We are from the medical fraternity, healthcare professionals. We should tell patients what is right, what is wrong. They should not panic, right? And gift a soap. Gift a soap to everyone who is in need, so that they can be benefited. Tell them how to wash hands. Tell them all the steps how to wash the hand. Use sanitizers. When to use mask. When not to use mask. Don't create a panic. Just be safe. Work safe. I would like to thank Dr. Sudeep Kale, President of Maharashtra OTPD Council, for his valuable suggestion in this video. Dr. Sanjay Parmar, Professor from SDM Dharwad, IAP advisory, which has been given in all the WhatsApp group and even in their website. Thank you for watching Physio Panda. I'll be making this video in Hindi for other viewers. Stay in touch, subscribe our channel, and stay safe.